right, today we're going to talk a little bit about group health coverage. Is it right for you? Is it the right thing to do? Can you even form a group? We're going to try and answer some questions here. Okay. Why are we talking about this? We're talking about this because this is going to be a predominant strategy for moving people off of the individual market into a guaranteed issue format of health insurance under group health coverage. So what does it take to form a group? Lynn, I'm only a sole proprietor with we're a husband and wife operation. Can we form a group? Yes, you can. Okay. It takes as little as 2 people to form group health coverage. Now, the structure is that you at least need to have the owner and 1 W-2 employee. Somebody at any point throughout the year who works at least 1 hour per week who's on a W-2 or wage and tax. Well, what if I'm not on a wage and tax right now? Well, perhaps you could set up your accounting to where that becomes part of your business entity, okay, where you hire somebody, whether it's a spouse or what have you, to create the legitimacy or the necessary requirements to form the group. Let's assume that all that is in play. And what does it take to get the group going? Groups always start on the first of a month. We can enroll into group coverage anytime throughout the year. So you can buy a group health plan on 10/1, 11/1, 1/1, 3/1. It doesn't matter. You can purchase a group health plan throughout the year. Okay? Group health plans traditionally are always going to be on a PPO chassis, not these smaller HMO chassis that we've had to force individual clients into over the last couple of years. So the PPO chassis are going to have between 12 and 15,000 docs. Most of all of, if not all of your major hospital systems. It's going to give you the choices that you need without having to get a referral. The prices are going to be stable. We're talking about 4% average rate increases rather than 20, 25%, 50, 122.8%. So these are all reasons to form a group. If you have pre-existing conditions, will they be covered? Yeah, they'll be covered. You bet. They are ACA compliant, and they will allow you to continue and get the coverage that you need. Are they going to be less expensive than what you're paying now? Probably not. They're probably going to be about the same as what you're paying, but over the long haul, they'll be less expensive in the fashion that there's not going to be the crazy rate increases that we've seen today. So, in order to form a group, we've learned that you have to have at least 2 people. We can purchase a group health plan year-round. We will be going back to a PPO style network. Our prices and rate increases will be much more stable than what they are on the individual Obamacare network or market. And so that's our primary strategy. And we're going to be moving as many people that we possibly can into group style coverage. Okay. In order to continue to make that happen, we need you to contact us so that we can get dates of birth and run what's called a census so that we can get a quote from our carriers. We shop the carriers, we get back to you within 24 to 48 hours. We sit down and figure out what's an appropriate plan for you, and at that point we make a decision and then we move forward with the paperwork. Okay? So it's not terribly difficult, it's not terribly complicated, it's something that we're really good at doing and helping you set up. It can be done either via screen sharing or we can invite you down here to the office, whatever works best for you. So we do encourage you, however, especially if you're a smaller group, to start sooner rather than later. 10/1, 11/1, 12/1 would all be desired effective dates. Why? Because come January 1st, when everybody and their mother is trying to get in for coverage at the last minute, it's going to make it very difficult when brokers, including myself, have to decide about helping a 2-man group or a 68-man group. Who do you think is going to get the attention? Okay, and that's based off of necessity. So the sooner that you get in and the sooner that we get your strategy going and moving forward, and we at least have it planned and set up and ready to go, the sooner that we can all make a nice, smooth transition into 2017. Thanks again for taking the time, and please contact us at 623-516-8300 or via email at info@phxhealthinsurance.com. To find the latest updates, please visit our website at phxhealthinsurance.com.